you have the tendon that passes through the lisosciatic foramen, and through the lisosciatic foramen from the outside that goes that goes out, which is the obturator nerve and internal the pudendal nerve, and then we have the internal pudendal vessels. They come out from the greater sciatic foramen, and they come back in through the lisosciatic foramen, and they come to the pelvis, the pudendal nerve and internal pudendal vessels. And basically these are, you see these two? So this is the pudendal nerve, and this is the internal pudendal vessels or artery. It comes out and then goes back in again through the lisosciatic foramen. And pudendal nerve basically goes to the perineal area and the external genitalia, and also part of the anal canal, the sphincters, okay, and supplies those areas, pudendal nerve. So that's that. So then we have the lateral rotator muscles. Okay, let's look at the deep muscles now. So first we have the piriformis muscle, right? We talked about that. Okay. And then we also have what we call as the piriformis syndrome, right? Syndrome.
Sciatic.
Right. Sciatica, it might compress the sciatic nerve, and that would create certain amount of muscle loss or pain sensation. Right. It would trigger the pain sensation and certain amount of numbness. Okay, this is sciatic nerve. You see, it basically it's beneath the gluteus maximus, as you can see, after it comes out from the infrapiriform foramen, and also it's also beneath the hamstring muscles. You see, it's beneath the hamstring. So these are the hamstring muscles, by the way. Laterally, we have the biceps femoris. Medially, we have semitendinosus and semimembranosus. If I get this out of the way, you will see the sciatic nerve. And sciatic nerve, as you can see, midway of the thigh, posterior thigh, okay, midway of the part of the posterior thigh, it branches into two branches. It gives off two branches. Laterally is common perineal, and medially is tibial. So we have tibial on the midline, medial located. Laterally is the common perineal, right? And basically, both tibial and common perineal innervates these muscles of the posterior thigh. We'll look at that a bit later. Okay, so that's sciatic nerve. Okay, so if we go and continue about the deep muscles beneath the piriformis, the muscles that we have here, these are called the lateral rotator muscles. So basically these lateral rotate the thigh. So which muscles are they first? Right, superior gemellis, and then obturator internus, inferior gemellis, quadratus femoris. Okay, that's about it. So let's look at the innervation of these muscles. Okay, so superior gemellis is what? Nerve to obturator internus.
Will you talk about the tensor fasciae lata?
Yeah, okay, yeah, we didn't talk about tensor fasciae lata, but yeah, we talked a little bit about that. So tensor fasciae lata, so we have tensor fasciae lata in terms of nerve innervation, gluteus medius minimus, and tensor fasciae lata is innervated by the superior gluteal nerve. And that's about it. Basically, it attaches to the iliotibial tract. It tenses the iliotibial tract, it tenses the knee joint, and also extends the leg. So the iliotibial tract extends the leg, and tensor fasciae lata basically assists in extending the leg, and forming a fixed support for the knee joint laterally. Okay, so so that's superior gemellis, obturator internus. So this is what? Nerve, the same. Nerve to obturator internus. And then we have inferior gemellis, quadratus femoris. Nerve is nerve to quadratus femoris. So nerve to quadratus femoris innervates quadratus femoris and gemellis inferior gemellis. And that's about it. And the function of these are lateral rotator. So they lateral rotate the thigh. So that's about it there. Okay, obturator externus, we're not going to talk much about that. Obturator externus is located, obturator externus, so this is the obturator internus, it's like here. So we have, so obturator internus originates from the internal aspect of the obturator foramen, obturator membrane, and obturator externus comes out from the external surface of the obturator membrane. That's the difference. So this obturator internus, it goes through, as you can see, it goes through the lysocytic foramen to come out and insert to the great trochanter. However, obturator internus, it doesn't have to go anywhere. It comes out from the external surface of the obturator membrane and attaches to the intertrochanter fossa. There's a fossa here, so it comes like from here and then medially and attaches to the great intertrochanter fossa over here. Okay, and again it adducts and slightly lateral rotates the thigh. Okay, and this is basically innervated by which nerve? Obturator nerve. Okay, right, obturator nerve. Or nerve to obturator externus. So branch. This is the branch of the obturator nerve. Okay, that's the obturator externus. Let's look at the posterior thigh. Okay, this is the posterior thigh. So posterior thigh is formed by the hamstring muscles, right? So laterally, so this is the lateral, as you can see. This is lateral. Is biceps femoris. Biceps femoris has two heads, right? So the long head is the one that is part of the hamstring. The long head, not the short head. Long head of the biceps femoris, semitendinous semimembranous. This is semitendinous on the top here. You see the it's long, the tendon part of this muscle. It's semitendinosus. Beneath that is semimembranosus. So we have semitendinosus, semimembranosus, and beneath semimembranosus we have the adductor part of the adductor magnus, with the hamstring part of the adductor magnus, which is this muscle here. Okay, so this is adductor magnus, by the way, and here we have the hamstring part of the adductor magnus. Okay, so the top one here is semitendinosus. Okay. The top one is semitendinosus. Everybody show me semitendinosus. And the muscle that is beneath is semimembranosus. Semitendinosus, we have more. It's like the half of the muscle is composed of the tendon. Semimembranosus is primarily fleshy, but it's flat. It's flat, that's why it's referred to semimembranosus. So all these three muscles plus adductor magnus, the hamstring part of the magnus, they originate from where? Ischial tuberosity. Ischial tuberosity is where? So this is ischial tuberosity here. So this here is the ischial tuberosity. So we're looking at the back here. So this is the ischial tuberosity. See? So which originate from ischial tuberosity? We have the semimembranosus, semitendinosus, and the long head of the biceps. And also we have the hamstring part of the adductor magnus. Okay? And all these muscles are innervated by which nerve? Tibial nerve, right? Tibial nerve, or the sciatic, or tibial division of the sciatic nerve. Tibial nerve. Okay? All these muscles are innervated by the tibial nerve. So basically, these. So this is the median.